rather learn from them and perhaps guide them and help them, taking the evidence from the science to help them acquire the social well-being that they're very capable of. So social well-being or social health, I think the meaning of that is going to differ from one place to another. And we don't have to really tailor-made, or you can or have a uniform definition of social health. Uh, just like you mentioned that people in Bhutan prioritize social health, and they gave more emphasis to their own tradition and religion and faith-based practices. And this is something that they think that they are proud of and that makes them happy. Their happiness index is something to feel envy of. So that is something we need to respect, what each community is desiring or conceptualizing or thinking of as their own social health. What is their need? So that means whoever is in charge has to listen. Is it government? Is it local government? Is it federal government? Have to listen to the communities. When you don't listen to the communities, you don't own that community. You don't let them know that you can trust on it. And a breach of trust is something that disturbs the entire system, the individual, the exosystem, the microsystem, all the system, which is very important from a public health lens, is disturbed. So I think that is something that is very important to determine the both economic realities and the security realities in our context. If people don't feel safe in their own home, how can we say that they would have any social health? Why don't they feel safe in their own homes? Why a mother would not let her child go out of the house to play? Why we don't have like public spaces? Why don't we have parks? Why don't we have any public space or community space where community can meet each other and perhaps do a lot of social interaction, and that's going to like really make them independent, give them autonomy to solve their own problems, perhaps by consulting with each other. So shrinking communal spaces, sense of absence of sense of safety, economic hardship, and education, not low, a very high attrition rate of young students, the increasing poverty line. So all these are the hard realities based on the statistics that one must take into account if we want to talk about policy implementations. One thing that is very, I think is relevant to this policy intervention part is that we don't see when policies are being made, intersectoral collaboration is something that is not seen. It's missed out. So each department is coming up with their own plans, and sometimes there's duplication as well. I'm aware during even COVID, some of the mental health interventions were literally duplicated. So resources are being, I think, wasted by having multiple programs focusing on the same thing. So we have many of the policies, but the thing is that we have to now gear for the action. And there has to be a political ownership of the social health aspect. Unless and until there is a political ownership, I don't think it's going to materialize. The demographic needs really demand that we are a young nation. We have so much potential. We are resilient. We are very innovative. But what are we offering to help develop the social health? One thing that I think that helps people stay resilient is this: when you keep the hope alive. What are we doing to keep the hope alive? Is the hope alive? If only we can give hope to our young ones, I think there's a lot of potential. and we can laugh at our troubles, and we can really rise again and work to help ourselves. So this is something that is, I think I would like to emphasize, is that we need to look at the statistics as per demographic when we talk about social health, and try implementing the policies to prevent and help the communities thrive, not survive, but thrive. When we have opportunities to thrive, only then our social health is something that we see visible. And there are, in the community spaces, it is really bubbling with energy. Otherwise, you are finding that the same population reporting to the medical emergencies. So that is something that is on my mind and that I wanted to share, because both of the speakers have really eloquently highlighted the other aspects. Thank you so much.